In the midst of all of our recent debate and discussion regarding healthcare in America, many people have rightly raised the question, what is the role of government in healthcare? And what should it be? Well, many people feel that government behaves as a benefactor in this area. They feel that healthcare should be organized and planned and supervised, purposefully funded for the nation as a whole. And they feel that representative government, particularly the federal government, is the best means to accomplish this. They feel that problems can and should be solved by increasing the involvement of government in healthcare, not by the opposite. Now, there are many other people who feel that government is more of a malefactor in this area. They feel that healthcare should be individually directed as a personal liberty, and that representation of the interests and needs of patients is best accomplished through supporting their authority to decide for themselves about their healthcare, through expecting them to take responsibility for their own health, and perhaps by empowering them financially. These folks feel that government activities tend to interfere with these goals and ideals, not promote them. Now, allow me, if you will, to give you one physician's perspective on this discussion. I'd like you to consider a question. Does your doctor work for you? Think about that a moment. Does your doctor work for you? Every patient wants to believe that his or her physician is focusing exclusively on his or her own health, with little consideration of financial matters or the physician's own interests. Every physician that I know wants to provide service in exactly this way. But reality sets in. The reality is that your doctor does work for you, but your doctor also works for those who pay the bulk of the bills. Before, during, and after a visit with you in the clinic or the hospital room, your physician has to attend to countless details that are almost entirely concerned with navigating requirements and restrictions to get you the services and testing and treatment that you need, and ensuring that he or she will ultimately get reimbursed by payers, your insurance company, Medicare, or Medicaid. Let me give you a few examples of how this plays out. Physicians must hire and train personnel to interact almost constantly with payers, to arrange agreements for care of patients covered under their plans, such as yourself, process paperwork for billings, keep track of detailed requirements by payers which are constantly changing, resubmit billings rejected by payers due to minor inconsistencies with the changing rules, and collect their reimbursements. This work by support staff is a big part of most physicians' practices. Patients are typically completely unaware of this activity, as it happens almost completely between providers and payers. Here's another example. Many payers require pre-certification for tests, especially expensive ones like MRI studies. This is a process which requires multiple phone calls, faxing of documentation, and completion of forms. As your doctor considers what is needed for your medical care, she also has to take into account what she can actually get covered under your payer's rules and how. She typically can't take the time both to arrange for your tests and explain the whole process to you, so you end up unaware of the hassle she's dealing with in the background and in her own mind. Here's another example. Payers make deals with pharmaceutical companies. Typically, the payer will agree to cover a company's drug exclusive of other similar drugs made by other companies in exchange for a bargain on the price of the drug. Formularies or lists of covered drugs often significantly differ from payer to payer, and payers make new deals constantly, so the formularies are always changing. Your doctor has to keep these restrictions in mind when recommending treatments, has to assist you in changing medications when your payer's formulary changes, and appeal to the payer on your behalf for coverage of non-formulary drugs if you cannot take or don't benefit from the drugs that they do cover. All of this takes time and a lot of effort. Here's another example. Documentation of doctor-patient interactions has to be detailed, specific, and accurate in order for your doctor to get paid. Payers, and the courts for that matter, operate under the assumption that if it is not documented, it didn't happen. So, if your doctor interviews, examines, counsels, and treats you for multiple problems or illnesses, she has to record the details of all of this in your record. A doctor who charges appropriate fees for her services, but does not document meticulously, much more meticulously than is really needed to do a good job in taking care of you, she runs the risk of audit by payers, followed by financially devastating fines and penalties. And I'm talking about practice closing, career ending fines and penalties. As a result, most physicians spend as much or more time on the medical record as they do with their patients. Now, when I tell you that I could go on all day with these kinds of examples, believe me, I could go on all day. There are many similar and even more dramatic examples that arise out of the hospital setting regarding interactions between hospitals and payers. So why do payers put these complex rules and requirements in place? Well, they claim to be ensuring quality care for their customers, like yourself, and holding providers accountable for their work, and some rules do seem to serve that purpose. However, the vast majority of these rules are really efforts to cut costs and avoid payments altogether by pushing back against the providers. This seems to be a particularly favored approach to reduction of expenses by the government entitlements like Medicare and Medicaid. They like to represent the program as a magnanimous benefactor to the public, and then shortchange the providers behind the scenes so that doctors and pharmacists and hospital personnel have to constantly explain to patients that recommended care is not available to them by their payer. They have to proceed with care that's contrary to the best course in order to get paid, and they have to find ways to generate revenues from other sources to make up for reimbursements from the government payers, which fall short of their own costs. Insurance companies typically follow suit by offering complex policies to customers which, while they're more transparent than the government programs, effectively obscure their real commitment to covering medical care. So does your doctor work for you? Well, I would submit that he or she tries and wants to, but a lot gets in the way.